So I'm going to talk about issues medical professionals face when treating patients due to upcoming issues and epidemics in medicine. So there are a lot of issues coming up in medicine, but today I'm just going to focus on a couple of those. So the main focus is going to be on the opioid epidemic, antibiotic resistance, what can be done to help with these, and the effect of these on professional medical care. So obviously, these issues are going to affect how physicians and other medical professionals are giving their care for their patients because of these issues. So the opioid epidemic. What actually is the opioid epidemic? I'm sure a lot of you have heard of it, but opioids are extracted from the opium poppy plant, and they're normally used in medicine to treat pain. They're very addicting though, so this is the thing that is coming in with the opioid epidemic, is they've been used to treat pain for many years in medicine, but now people are becoming addicted to them and abusing them. And the United Nations Office of Drug and Crime in 2015 did like a drug report where they showed how many people were actually using and abusing drugs. And more than 29 million people worldwide misused and abused drugs in 2015, and the use of opioids accounted for approximately 70% of this misuse of drugs. So one of the issues that comes in with the opioid epidemic is drug seeking. This makes it hard for medical professionals to determine who needs the medication and who doesn't. So medical professionals are kind of having to decide if somebody's lying or if somebody actually needs a medication to help them with their pain. So Morris and Murr, in their study, they kind of looked at like how the patient-physician relationship is and everything like that. So what they actually said is the foundation of a patient-physician relationship is built upon trust, and physicians trust that patient's subjective report of his or her level of pain is accurate, and then they do their best to adequately control the patient's discomfort. So obviously within this opioid epidemic, it's becoming harder for physicians to actually trust their patients with their level of pain, because some people are coming in and they're trying to just get the drugs because they're abusing them and things like that. So it's kind of making it harder for these physicians to treat these patients. I also had a story that when I was shadowing, I think I mentioned it in my previous presentation, but it was about a guy that came in and he asked for a specific medication, and a lot of times if somebody comes in and asks for a specific medication, that's kind of like a red flag because they might have already had it or they're abusing it right now. So things like that you have to look for as a physician as well. So another thing with the opioid epidemic is physician autonomy. So there's a lot more rules and regulations due to the opioid epidemic. I think some of these rules are helpful, but some of them are also kind of limiting physicians on how they treat their patients, and you kind of have to, now physicians can't really treat patients case by case basis. They kind of have to follow these rules and regulations. And Guverman et al. Looked at these federal and state rules that are now coming into place. So they said that federal and state governments have adopted what are in many cases exceedingly detailed and unusual restrictions on how physicians may use and prescribe opioids and how physicians must interact when prescribing them. So it's very specific on how physicians have to be when they're prescribing medications and how much they can do and things like that. So that makes it harder for physicians to actually treat their patients. So now what can actually help with the opioid epidemic? Some of the laws and regulations do help, like I said. I think one of the ones that helps a lot is database logging. And this is kind of like the amount of medication and when a patient had it last. So when I was shadowing, I actually saw this. So what the PA or the physician has to do is they have to put the pain medication in a database if they're going to give it to the patient. And in the database, it actually shows when the patient last had a pain medication and how much of it they had and things like that. So that helps them see if they're abusing the drugs or if they're actually getting them for a certain reason. And Pon et al. Looked at things that can actually help with the opioid epidemic, and they believe that a multifaceted approach, including education, monitoring, proper disposal, and enforcement, is going to be the best way to treat this. And it's not going to be just one of these, it's going to have to be all of these together. And the picture kind of goes through this again. It just talks about how you need to raise awareness about the dangers of prescription drug abuse, educate patients on proper disposal of the prescription opioids, utilize prescription drug monitoring programs. That's kind of like the database logging like I talked about. And then enforcement. So that's like stopping people on the streets that are giving drugs and things like that. So that needs to be helped with like law enforcement. So now I'm going to go into antibiotic resistance. So I'm sure a lot of you have heard of this as well. But antibiotic resistance happens when a bacteria that once could be treated with an antibiotic becomes resistant to it. And this can actually happen in many ways. And Munita et al. In 2016 looked at the actual mechanistic ways and how this happens. So these might sound a little confusing, but it's just talking about the different ways mechanistically that this can happen. And this includes modification of antimicrobial molecule, prevention to reach target, changes or bypass of target sites and cell adaptive processes. So once the antibiotic is introduced, these are different ways that it can become resistant to the antibiotic. So now an issue that comes in with antibiotic resistance is overprescription. So Gupta et al. Actually found that multi-drug resistant pathogens are now on the rise. So this means that not only is a pathogen resistant to one antibiotic, but now it's resistant to multiple antibiotics. So physicians and other medical professionals are now having to try to find multiple drugs to treat an illness instead of one antibiotic that used to actually just cure it, and now it's harder for them to find something that works, and a lot of the times they have to prescribe multiple drugs to cure whatever the patient has. And many people are being prescribed antibiotics when they don't need them, so this is also something that happens in the doctor's office, and I'm sure a lot of people have gone to the doctor and they prescribe antibiotics when they don't actually need them. And I think this kind of comes in when people go to the doctor and they think that they need a medication when they leave the office. If a doctor just says rest and drink fluids, the patient's going to think that the doctor's appointment was a waste of time. So I think physicians think they need to give something for a patient to think that they're going to feel better. So I think that that's kind of what comes into that. I think that this is one of the most important when it comes to this. I think that antibiotic resistance can be helped a lot with patient education. And physicians kind of just need to explain like why you don't need an antibiotic for a cold, or why you don't need it for everything that you come in with being sick, and why it's important for patients to take the whole dose. So this picture from the CDC kind of shows it really well. So if you stop taking your dose halfway through, the antibiotics the bacteria that were introduced to the antibiotics are now going to be resistant because they were slowly introduced to antibiotics and they lived. So now these bacteria can transfer their genes to other bacteria in you, and then now when you get sick again and you try to take the same antibiotics, they're going to be resistant to that antibiotic because you didn't take your whole dose and they transferred their genes to make their bacteria resistant. So antibiotic resistance, what could help in future research? Like I said, I think the main thing that could help with this is patient education. Medical professionals staying educated on new treatment methods and different drug combinations until antibiotics are found. Like I said, a lot of the time physicians are having to kind of make drug combinations in order to treat these illnesses because of the bacteria being resistant to the antibiotics. I think, like I said, future research needs to be done, and Wright in 2014 looked at how there aren't really new antibiotics coming out, and there have only been a handful of new antibiotics approved for clinical use in the past 2 decades. So at first, I think we created a lot of antibiotics and then we kind of stopped, and now that's why these bacteria are becoming resistant, because we don't have new things to treat them. And medical professionals, like I said, are being pressured to find these new treatments because the pathogens are becoming resistant to many drugs, not just one antibiotic. So in conclusion, I think it's becoming harder for medical professionals to actually treat patients due to these problems, and with the help of patient education and monitoring, some of these can be helped. Like I said, much more research is needed to be able to find a way to help these problems fully. But my perspective on this is that I think that with patient education, a lot of these issues can be helped. Obviously, the opioid epidemic is a little more complicated than antibiotic resistance, but antibiotic resistance, I think, can definitely be helped with a lot of patient education. And I'll just leave you with this. There's always going to be issues in medicine, but I think it's important for medical professionals to adapt and change in order to save lives. Does anybody have any questions?